Hello, this is Neil Baum from New Orleans, and I'd like to take just a few moments to talk with you about an update on the use of medical marijuana. This is receiving a lot of publicity, both in the healthcare publications as well as the media. And I think more and more patients are going to be asking their physicians, including urologists, about the medicinal use of marijuana. So this video will cover or discuss a brief history of marijuana, the medicinal effects of marijuana, and several applications of the medical use of marijuana. Marijuana was first discovered or first used as an herbal medicine in 500 BC. And I don't want to go through all of those milestones there, but the FDA has approved several drugs to treat nausea and vomiting associated with chemotherapy and loss of appetite. I clearly remember growing up and going to the movie theaters, and in between the movies, they would have a short called Reefer Madness. And this movie scared people and emphasized the danger and the addiction associated with the use of marijuana. In 1937, there was a tax act that imposed an excise tax on the sale or possession of all marijuana products, thus effectively criminalizing the use of marijuana. In 1970, President Nixon declared that marijuana was a Schedule I drug, that is, along with heroin and LSD, and emphasized that there was no medical uses for marijuana and a high potential for abuse and addiction. And it was considered a gateway drug to other more addictive medications. Today, 50 million Americans use marijuana, and 29 states have legalized the use of marijuana even for recreational purposes. Terms used associated with marijuana include cannabis and hemp. Hemp is less than 0.3% of the active ingredient of tetrahydrocannabinol. Marijuana contains both THC and CBD. CBD is not the psychoactive component of cannabis, and it's one of the most studied chemicals for the use of medicinal purposes of marijuana. The psychoactive component is the THC. The THC produces the euphoria and the increased appetite, which are the short-lived effects of marijuana. The CBD is considered an anti-inflammatory and possibly associated with pain relief. The medical uses of marijuana are shown in this slide, and I plan to go through them briefly to discuss their advantages and disadvantages. Marijuana has been thought to relieve chronic pain, especially CBD component of marijuana. However, there is limited evidence for the use of marijuana for pain relief. It is considered an option for the use of opioids. I point out to you that a recent article in the Wall Street Journal documented that there are now in the United States greater than 100,000 deaths associated with the use of opioids. Marijuana has been advocated for end-of-life care, as 80% of patients who are at end-of-life care, especially for cancer, have severe pain and breakthrough pain. Breakthrough pain is the sudden, brief pain that occurs during a period when chronic pain is generally well controlled, typically with the use of opioids. Marijuana has had a use in addiction. However, it's controversial, and it is felt to be helpful for detox in patients with severe drug addictions. Marijuana has been reported to be beneficial in patients with depression, anxiety disorders, and particularly studied in post-traumatic stress disorder. Again, controversial, although a recent report showed that it is effective in recovery from PTSD. However, there needs to be random placebo-controlled trials needed to determine how effective marijuana is. Marijuana may help in patients who suffer from insomnia. I can share with you my own experience with CBD, as I have trouble not falling asleep, but waking up during the night and not getting back to sleep. I used CBD oil, and it was effective for a few nights, perhaps the placebo effect, and then it lost its efficacy in my situation. Marijuana has been used for treating the nausea and vomiting associated with chemotherapy, and the American Cancer Society includes CBD as a treatment for nausea and vomiting associated with chemotherapy. It has also been used in patients with gastrointestinal disorders, particularly irritable bowel syndrome and inflammatory bowel disease, and has been effectively studied for increasing the appetite in AIDS patients. CBD has been used and has been reported extensively in the management of multiple sclerosis, which is felt to be an autoimmune disorder, and the CBD is an immunosuppressive and may be helpful in these patients. The National Multiple Sclerosis Society advocates for the use of CBD in multiple sclerosis patients. Finally, CBD has been used effectively in patients with seizure disorder. A significant number of patients have difficulty controlling their seizures, and the FDA has approved a CBD-like drug, Epidiolex, for treating rare forms of epilepsy. CBD is contraindicated in patients who have a history of drug or alcohol addiction. Also, CBD is perhaps contraindicated for patients with chronic obstructive pulmonary disease and asthma, especially associated with smoking, as it may trigger an attack of asthma. CBD should be used in caution in patients with liver disease, as it may promote liver toxicity, and liver enzymes need to be monitored. The bottom line on the use of cannabis is that there are indefensible claims of its medicinal value. It has not been well regulated by the FDA, and more research is required. However, it may be helpful in patients suffering from insomnia, in patients with chronic pain, in patients who are suffering from nausea and vomiting associated with chemotherapy, and in certain forms of epilepsy. The FDA is quoted as saying it is not safe or effective in the treatment of any medical condition. However, the American Cancer Society leaves the door open and stating that further research on marijuana for medicinal purposes is required. Well, I hope you have found this video helpful and useful and will give you a reasonable update on the medicinal use of marijuana in certain medical conditions. If you have any comments or suggestions, please let me hear from you at the email address shown on this last slide.